There have been major updates in Medicaid expansion negotiations as the 2024 legislative session nears its end.
The Senate conferees have sent their counteroffer to the House and await action in that chamber. Now, we've got team coverage with 12 News' Byron Brown and senior political correspondent Richard Lake. They both join us live now from the state capitol, and they have more on this day's developments. Byron?
Hey, Walt, Melanie, this has been a crazy week here at the state capitol with both sides going back and forth on this Medicaid expansion. If this were a game of poker, you'd like to say who has the best hand. It started out with the House showing their hand, and today the Senate played their hand. And senior political correspondent Richard Lake is here. And Richard, this has really been a really crazy week with both sides really going at it.
It absolutely has been. Tuesday was when we first saw the House and the Senate meet for the first time publicly. We had no meeting Wednesday. Thursday, we saw the House show up to an empty negotiating table as Senate conferees did not show up to that scheduled meeting that afternoon. And now today we have the Senate offering their hand, like you said, with their counteroffer. And it is very similar to the original compromise that House conferees gave to the Senate on that Tuesday meeting, but it has a much stricter work requirement. The most notable point of this counteroffer is the fact that this increases the percentage of the federal poverty level up to 138%. That's a huge change compared to the original 99% federal poverty level the Senate was previously at. Like the House compromise, Mississippians between 0 and 99% of the federal poverty level would be covered through Medicaid in the Senate compromise. Those between 100 and 138% of the federal poverty level would stay on the federal insurance exchange, and the state would pay 10% of those insurance costs. Now, this plan would also draw down the maximum federal dollar match, and all three Senate conferees are hoping the House considers this offer.
Our plan is real similar to the first, where we were covering the folks from 0 up to 100%, and so now we've went ahead and extended up to the 138 percentile work requirement. So it's almost everything that was in our first bill is in this one. So the work requirements are there, the exceptions are still in there. We put a little bit stronger language if the bill should be. CMS denies it, then the department shall file a lawsuit along with the assistance of the Attorney General.
We reviewed the financing and listened to the House and to see where we needed to be to reach a compromise. And so we've worked and we've come up with a solution. We think this is a positive solution. I'm hoping it's something that the House finds amenable, and we can make sure that we close the coverage gap in Mississippi and really provide the health care that so many Mississippians need right now.
This is a working poor waiver, if you will. And so I think that makes all the sense in the world, and it's unique to Mississippi. Part of this was getting the financing right, and I think that's what you see in our plan. And in our discussions, the House, accepted the exchange. With that, we're able to accept going up to the 138%.
Now, the House can either agree and sign on to one of these offers, amend one of them, or decline both offers. And we are also awaiting action on education funding. There has been some serious ground made on a compromise between an alternative MAEP education funding formula. The House Education Committee is meeting as we speak, and lawmakers are waiting to get their hands on whatever compromise the House and Senate hopefully came up with.
Yeah, and we're still waiting to hear from the House on this new deal.
On expansion.
And the
yes,
expansion here, and we haven't heard from them. The Senate left earlier today, so the House is still here, but it's still going to be a long weekend because we know that they're coming to come back this weekend and still do some work. So a lot of work still ahead. And was it about a week left in the session before it all ends?
Yes, May 5th. May 5th is sine die, counter sine die.
All right, a lot going on here. A busy week here at the state capitol, and still much more to come up. We're going to have much more coming up at 5 and 6 o'clock on the Medicaid expansion. Walt, Melanie, now back to you.